worldwide access to rapid emergency mechanical thrombectomy. And we want to do this by integrating the disparate knowledge of barriers that is present in every country, unify multiple efforts by local and specialty societies, and we aim to do this by developing and implementing high-impact public health interventions. When we started, we aimed to double the access every 2 years for the next decade, and I'll show you that we did achieve the 202,000 thrombectomy goal in 2020, 6 years ago. The regional committees have an action plan. They just disseminate the white paper to the policymakers in their individual countries that has been written by Mission Thrombectomy that tells them what is stroke, what is LVO stroke, how to develop thrombectomy systems of care. And we also developed a smartphone app that is undergoing a revision right now to track thrombectomies. We conduct regional surveys and analysis of the infrastructure, and we coordinate with the regional committees to develop every year public health interventions to increase access to thrombectomy. And one of the ongoing public health interventions is stroke center certification in their countries. What are public health interventions? Public health interventions are upstream strategies that are not hospital by hospital. They are on a country and state level where they target economic, political, and community factors that could substantially increase access to treatment. And this means policies and investment at the governmental level. What kind of targets do these public health interventions have? We wrote this paper about the well-known concept of pillars of access. The first pillar of access is information and diagnostic access. Public awareness about stroke and education of doctors on LVO stroke and its triage is the first access that needs to be developed. I'm going to go a little fast. Physical barriers, which include the thrombectomy centers and thrombectomy specialists, are the second targets of these public health interventions. And then the financial pillar is a crucial target because reimbursement of thrombectomy and investment into a thrombectomy systems of care are extremely important. So how do we put all these together? We advocate with policymakers and other stakeholders. We do population education to increase awareness among both the non-medical and medical personnel about LVO and LVO stroke and thrombectomy. And then we leverage technology, including what I spoke about yesterday, which is really cutting-edge technologies that are emerging, like remote thrombectomy, but until then using a lot of the smartphone and tele-observership to increase access to thrombectomy. Our growth has been really quite extraordinary. We were launched in 2016. We did a pilot survey in 2017 in the US. We did a formation of the global executive committee and the regional committees starting in 2019. And as of 2025, we have 109 regional committees in over 90 countries. This has really been quite amazing to achieve, and this has allowed us to be in all 6 continents, and we are now able to do registry and research. We have collaboration with WSO, which is the World Stroke Organization, American Heart, with Angels, with multiple companies. We do education and training. I told you about the work with the regional committees of advocacy, education, and increasing access with technology. We raise funds to achieve our mission through grants and other means, and we collaborate with the World Health Organization and the UN to advocate for stroke access globally. We did the first study called Empty Glass to show to quantitate the global access to thrombectomy. We had 887 survey responses from 61 countries, and we found that global access to mechanical thrombectomy is staggeringly low at 2.79% only. It's less than 1% for 18 countries in the survey, and there is a 460-fold disparity between the highest country and the lowest country, which is Australia has 46% access in this study, and Bangladesh has 0.1% access to thrombectomy after excluding all the countries that have zero access. And this kind of disparity would be never acceptable in a global disease in general, like the pandemic, but it is the reality for stroke. What you can also see is that the access is totally correlated with the GDP of the country. Low and middle income countries have less than 0.5% access. Middle income countries have 2.7% access, and high income countries on a median have 21% access to thrombectomy. So this is where we need to work on. This is the white paper that we wrote in 2020 and disseminated across now 25 countries and translated into over 19 languages. We have our website that's very educational and both for the public and the doctors. And we, as I said, have multiple country health ministries endorse the white paper and adopt it. This is a release in India in 2022 that led to in 2021 that led to a tripling of reimbursement for thrombectomy in the Ayushman Bharat insurance scheme for low-income citizens in India, and the access to thrombectomy has certainly improved since then. And as I said, the white paper has been translated into 19 languages and adopted in multiple countries. Mission Thrombectomy is a consultant society for the UN ECOSOC, and we advocate for thrombectomy, and we work with multiple organizations, including the WHO, to advocate for increasing the visibility of thrombectomy in the WHO policies. WHO has listed thrombectomy devices as essential devices. This is the app that we use to track thrombectomy. It's undergoing a revision, and the countries that have really taken this to a next level include China, where the China Mission Thrombectomy Committee has doubled the thrombectomy between 2020 and 2022 and has shown how this approach really works. We have multiple countries that we are working with. This is a Sierra Leone plan, so even small countries in sub-Saharan Africa that we are working with to increase access. We do multiple workshops. This is Dr. Nijasri in Thailand, who worked with us for workshops there. This is a workshop in India that I conducted along with others last year. And this is something that, 2 years ago, that helps local thrombectomy teams to increase their experience with thrombectomy and implement thrombectomy systems. We've also launched the SILK certification. That is a certification for angiography suites to certify angiography suites for thrombectomy and meet the highest standards. And this is something that's now been done in over 20 angiography suites around the world, and we're hoping to do it in Ho Chi Minh City also at the People's 115 Hospital soon. There is a formal application system that's online, and it's actually free of charge, and it allows for the highest level of thrombectomy performance by an angiography suite. We were invited by the UN General Assembly and Global Stroke Coalition to a side event at the UN General Assembly last week. This is Dr. Fawaz Al-Mufti and me to talk about mission thrombectomy. And we've co-authored the Lancet Neurology Commission with WSO on stroke and stroke access, and we have multiple partners across industry and societies to achieve our mission. We launched the World Thrombectomy Day in 2021 as May 15th, and this has been now observed for the last 5 years around the world. And we do many public health campaigns that are around World Thrombectomy Day. And we have launched a teleobservership as of last year that allows for early career thrombectomy specialists to log in from their home on their smartphones and watch thrombectomy and other neurointerventional procedures live with a two-way exchange. And the grassroots trial is something that I had the privilege of leading. It's not through Mission Thrombectomy, but it was really inspired by Mission Thrombectomy to conduct a new device trial in India for thrombectomy that has been now approved in India. This is a BFAST challenge that we did around World Thrombectomy Day to use dance as a method of communicating the signs and symptoms of stroke to the public. I'm not going to play the whole video, but we used dance and we challenged people to put this on social media. So this is loss of balance that she's showing with Bharatanatyam from India, and this is the eyes. She's showing that the sudden eye symptoms can be a stroke symptom, sudden face droop, and sudden loss of arm strength, and then the loss of speech, and then time to call 911. And this sort of public challenge is what is needed. We were featured in the New York Times 2 years ago and in multiple other publications. So in conclusion, even after 11 years of proving thrombectomy being highly effective for large vessel occlusion, the global access to thrombectomy remains below 5%. According to the MD class study, this access is highly disparate, and almost a 500-fold disparity exists in the globe for access to thrombectomy. The three well-established barriers to treatment access, information access, physical access, and financial access can really guide solutions to overcoming barriers to access. The global health initiatives such as Mission Thrombectomy, the World Stroke Organization Implementation Task Force, and the GSAC can aim to address these inequities and gaps in access to thrombectomy. Public health interventions customized to the country and region are highly powerful, well-proven tools to implement continuous growth in access to thrombectomy with local stakeholders, and multi-stakeholder collaboration along with policymakers, politicians, with hospital CEOs, and communication with these stakeholders can develop and build empty system strokes of care and accelerate access to thrombectomy. I want to acknowledge all the core executive committee members as well as all the global executive committee members around the world, including Vietnam, for the tremendous partnership and work that they have done together. And thank you so much for listening.